You know how sometimes, out of nowhere, you spot those flaky patches in your baby's hair and think, what's up with that? That's cradle cap, and it's super common, nothing to stress about. Almost every baby gets it, just part of growing up. So what can you do to help clear it up naturally? Stick around and I'll share some tips. And hey, if you find this info helpful, give us a like and stay tuned for more insights. Understanding cradle cap. Alright, let's dive deeper into this whole cradle cap situation. You've probably heard it tossed around by pediatricians or seen it in parenting books, but what exactly is it? Cradle cap looks like baby's first attempt at dandruff, but it's not caused by dry skin. Instead, it's those oily patches that create scaly or flaky spots on their little heads. The fancy term, seborrheic dermatitis. It sounds like something out of a sci-fi movie, but it's just a fancy way of saying your baby's scalp is going through a phase, literally. Now you might wonder, why does my baby get this? It's all about the oil. Yes, even babies can have an overproduction of sebum, which combined with yeast that lives on the skin, can lead to cradle cap. It mostly shows up in infants up to 3 months old, but can stick around a bit longer for some. And get this, it's not just the scalp that can host these flaky parties, it can spread to the eyebrows, behind the ears, or even the diaper area, though that's less common. It doesn't bother your baby one bit. They're not itching or feeling uncomfortable. It's purely a cosmetic thing, which means it's more about us, the parents, getting used to the idea that it's part of the baby package. So before you start Googling baby scalp spa treatments, remember, cradle cap is a temporary guest in your baby's life. It's a sign that your little one's skin is adjusting to life outside the womb. And while it might seem like it's sticking around to test your patience, it's on its way out. Stick around for some simple, natural ways to help speed up the process without turning your bathroom into a spa for infants. And hey, if you're finding this dive into cradle cap intriguing, why not hit that like button? It helps more than you know. Causes and misconceptions. Time to tackle what really lights the fire under cradle cap, that pesky duo of excess oil and yeast. See, babies have these oil-producing glands that can go a bit overboard, especially in the first few months. It's like their little bodies are trying to figure out the right balance. And then there's the yeast. Yes, we all have it, even our adorable babies. It's usually harmless, just hanging out on the skin, but sometimes it finds all that extra oil too tempting and decides to party, leading to cradle cap. Now let's clear the air on some myths. You might hear people say cradle cap comes from not washing your baby's head enough or because they have allergies. Here's the deal, cradle cap isn't about cleanliness or allergies. It's not caused by bad hygiene. And it's not an allergic reaction. Even the squeakiest clean babies can have it because it's more about internal factors, like hormone levels passed from mother to baby, than how often you bathe them. So if you're ever at a family gathering and someone hints you're not pampering your baby's scalp enough, just nod and smile, knowing it's all part of the baby's natural process. The important thing to remember is that cradle cap, although it looks like a flaky nuisance, is mostly harmless and sorts itself out over time. No need for fancy treatments or to blame the soap you're using. Keep it simple, keep it gentle, and keep tuned, because up next, I'll share some no-fuss ways to help manage those flaky patches. And if you're soaking up this info and looking forward to more, how about showing some love with a like? It really helps us keep these tips coming. Natural remedies and treatments. So now we're getting to the good part: how to deal with cradle cap naturally. No need for fancy treatments or expensive products. Often, the best approach is the simplest one. First off, regular washing can do wonders. A mild baby shampoo and warm water routine during bath time can help loosen those scales and keep the skin hydrated. But here's a pro tip: oils are your best friend in this battle. Natural oils like coconut, almond, or even olive oil can be gently massaged into your baby's scalp to soften the scales. Just a little dab, let it sit for a few minutes, or hey, why not make it a relaxing massage time? After the oil has had a chance to work its magic, you can use a soft bristled brush or a fine-toothed comb to gently remove the flakes. It's like a mini spa day for your baby, minus the spa prices. Now I know what you're thinking, is that it? Pretty much yes. Keeping the affected area clean and moisturized is key. And while we're at it, let's bust a myth: more frequent shampooing isn't necessarily better. Overwashing can actually irritate the skin and make things worse. So strike a balance that works for your baby. Remember, the goal here isn't immediate perfection. It's about providing gentle, loving care to help your baby's skin heal naturally. And sure, the cradle cap might seem stubborn, but it's no match for a patient and caring parent. In the meantime, if you're finding these tips helpful, give us a thumbs up and don't forget to subscribe for more straightforward baby care advice. When to seek medical advice. Even though cradle cap is mostly a waited out kind of deal, there are times when you might need to bring in the pros. So when should you switch from home spa treatments to a doctor's visit? Well, it's all about spotting the signs that things are a bit out of the ordinary. First up, if those scaly patches start looking more red and irritated than usual, or if they spread beyond the usual spots like the scalp and eyebrows, it's a good idea to check in with your pediatrician. We're talking about areas you wouldn't expect, like the armpits or the diaper zone, getting in on the flaky action. And here's a big one: if your baby seems itchy, in pain, or more fussy than their usual self, or if there's any sign of infection. Think yellowish crusts or weeping sores. Don't wait it out. These could be signs that what started as simple cradle cap is turning into something needing a bit more medical attention. Another thing to watch for is if the cradle cap just isn't getting better, even with all your tender, loving care and natural remedies, especially after a few weeks, or if it's getting noticeably worse. Baby's skin can be sensitive, and sometimes what works like a charm for one kiddo doesn't cut it for another. So while it's great to tackle cradle cap with gentle washes and oil massages, being vigilant about these symptoms is key. If you're nodding along and thinking, yep, I needed to know this, why not show some love by liking this video? And if you're all about staying informed on baby health and wellness, hitting that subscribe button is the way to go. Let's keep these practical tips and insights coming right when you need them. Wrapping up, cradle cap is just a phase in your baby's early months, nothing to fret over. With some simple, gentle care, it'll pass before you know it. Remember, you're doing great, and so is your little one. If this guide was helpful, why not drop a comment, share with fellow parents, and subscribe to our channel for more straightforward baby care insights. Your support helps us keep bringing helpful content your way. Thanks for watching.